First thing to discuss before talking about continuing education is what an RN does. Registered nurses provide and coordinate patient care, educate patients and the public about various health conditions, as well as provide advice and emotional support to patients and their families. They can work in hospitals, physicians' offices, community settings, home health care, as well as nursing homes and many other facilities. Employment of a registered nurse is projected to grow 19% from 2012 to 2022 to over an estimated 3.3 million, with an average earning of roughly $67,000 in 2013, according to the Bureau of Labor Statistics. Bachelor's degree programs usually take an average of 4 years to complete. These programs offer more clinical experience in non-hospital settings, and the bachelor's degree is often, or higher, is often necessary for administrative positions, research, consultation, and teaching. Currently, 33% of schools offer one or more RN bachelorette program. 29% of schools in Canada offer one or more master's programs, and 23% of schools offer one or more NP programs, which includes post-NP, masters, and postmasters. Examples of continuing nursing education that will be discussed in this video but are not limited to include master's programs, nurse practitioner, nurse anesthetist, and PhD.
One of the options for continuing your education is getting your master's in nursing. To make this information more relevant and applicable, I took information from universities in the surrounding areas, such as University of Windsor, Ryerson, York, Western, and McMaster. So the job description and role associated with a Master's of Science in Nursing depends on the avenue which you would like to pursue. There are 3 different fields. Advanced Clinical Practice Nursing field, which has goals that include human health experience, well-being, healing, and illness, literature review of selected concepts, and skills required to manage multicultural needs in Canada, including health promotion, illness prevention, and adaptation. There's also Nursing Leadership field, which includes leadership in management, research, and education, critical appraisal and synthesis of educational, environmental, and political issues, and developing skills to impact policy and decision-making relevant to the profession of nursing. The third field is primary health care and nurse practitioner, which includes goals of preparation to provide and collaborate to individuals, groups, or communities with an emphasis on health promotion and illness and injury prevention. Education and schooling. Further education can be pursued at universities across Canada once you have successfully completed your BSCN degree. Many universities in southwestern Ontario have the option of completing a Master's in Nursing or a combined Master's of Nursing with primary health care nurse practitioner. The standards and application process of the master's degree is quite high. Some examples of requirements include having successfully completed a BSCN, having a minimum of a B to B+ average, having a membership with the RNAO, having 3 academic nursing references, writing a scholarly paper, some are up to 15 to 25 pages upon the university request, providing a resume or cover letter, and a preparation for an interview. The Master's in Nursing and Primary Healthcare Nurse Practitioner requires all of that previous info and a minimum of 2 years of full-time experience. Some universities offer online programs, and some provide in-class programs requiring mandatory attendance. Some programs ask for deposits or acceptance fees that can reach up to $500. The course load differs from campus to campus, which are about 10 courses for completion. Upon completion of your master's, it allows opportunities to further advance into nursing practices such as nurse practitioner, midwife, clinical nurse specialist, nurse administrator, nurse informatics specialist, and nurse anesthetist. The annual income for some of the ranges and avenues for Masters in Nursing include, for nurse practitioner, $87,000 to $119,000 annually, midwife $84,000 to $118,000, clinical nurse specialist $83,000 to $118,000, nurse administrator $64,000 to $100,000, nurse educator $71,000 to $100,000 annually, and nurse anesthetist coming in the top at $150,000 to $201,000 annually. So that's about it.
Nurse practitioners, also known as NPs, are registered nurses who have additional nursing education and experience in the specialty field of their choice, whether it be primary healthcare, adults, or pediatrics. Primary healthcare NPs generally work in community settings and provide general health care services to people of all ages, including annual physicals, counseling, health promotion, immunization screening, monitoring chronic diseases, treating short-term acute illnesses, and providing referrals. Adult and pediatric NPs tend to work in hospital settings and provide specialized care services to patients with acute and/or critical illnesses such as cardiovascular disease and cancer. With a wider scope of practice, NPs' competencies build and expand upon the RN competencies. Nurse practitioners have and demonstrate the competencies to use their authority to diagnose, to order and interpret diagnostic tests, provide pharmaceuticals, and perform procedures. Nurse practitioners also teach individuals and their families about healthy living practices, preventing disease, and managing illnesses. NPs provide care in diverse health settings such as long-term care settings, hospitals, NP-led clinics, and community care settings such as doctor's offices, clinics, and home care in partnership with interdisciplinary teams. To register as an NP, nurses must meet certain registration requirements such as successful completion of an approved master's degree in the specialty area. Fast-track programs exist for nurses with a bachelor's degree, allowing them to complete the requirements in 2 years. However, new students will require 5 to 7 years to become an NP. The average pay ranges from $87,830 to $119,065. Each provincial and territorial government has NP legislation in place. There are close to 3,000 NPs in Canada, with the largest number found in Ontario.
Registered nurse anesthetist, or CRNAs, are some of the most advanced and highest paid of all nurses, with an average yearly income of $160,000. CRNAs administer anesthesia during surgery when an anesthesiologist is not available to do so. In fact, CRNAs actually predate anesthesiologists, as they came into existence during the Civil War in the 1800s when anesthesia itself was new. In the U.S., there are over 30,000 practicing CRNAs who are responsible for the delivery of over 65% of all anesthetics to patients. CRNAs usually work in operating rooms in hospitals, but they may also work in outpatient surgery centers and medical offices. They are responsible for doing a pre-op assessment of the patient, administering the anesthesia during the surgery, bringing the patient back out of anesthesia, and then following up to ensure the patient's recovery. In the U.S., job security is very high for CRNAs. Even though they earn more than most primary care physicians, they are 2 to 3 times more cost-effective than anesthesiologists and virtually have the same scope of practice. However, Canada is currently quite far behind the U.S. in this career category. In fact, the U.S. was exploring master levels nurse anesthetist programs back in the 70s, whilst the government here in Ontario only announced theirs in 2007. Before gaining admission into a graduate nurse anesthetist program, you must have a BSCN, be a licensed RN by passing the NCLEX RN, and have 1 year of experience in a high acuity area such as the OR, ER, or ICU. Most nurse anesthetist programs take 2 or 3 years to complete, and after completing the program, you must pass the national certification exam in order to practice legally as a CRNA in the U.S. In Canada, the University of Toronto offers 2 programs to obtain specialty knowledge in anesthesia care for nurses. The first being a Postmaster of Nursing diploma for current nurse practitioners, and the second being a Master of Nursing to become an NP in anesthesia care. Therefore, in Canada, there still aren't any CRNAs, but nurse practitioners in anesthesia care, or NPAs, are slowly becoming utilized.
Hello everyone, my name is Mike McKenzie and I'm currently in the 4th year, 2nd semester of the BSCN program. and I'm here to talk to you about the PhD program for nursing. So each school has a different criteria to gain entree into their PhD nursing program. The applicants must have a completion of master levels research, thesis or equivalent of, 2 academic references and 1 clinical reference. Some Canadian schools are looking for the applicant to create a personal essay with insight to the applicant's motivation and interest in the PhD program. The applicant must include and identify to the faculty member who agrees to supervise the applicant through the doctoring process. The applicant must provide evidence to their current registration of their eligibility for registration with the College of Nurses of Ontario. 4 reasons why you should obtain your PhD in nursing. 1. You want to teach the next generation of nurses. 2. You have a passion for top-notch clinical care. 3. You want to move forward in your profession. And 4. You want to improve healthcare. And so, what would you do with your PhD in nursing? Pretty much whatever you want. There are PhD prepared nurses who teach, conduct research, evaluate programs, write books, and lead healthcare organizations and work for the government. With a doctoral degree, the sky is the limit. At the doctoral level, nursing is less about hands-on patient care and more about abstract thinking and helping move the profession forward. More than anything else, a nurse with a PhD has the training needed to conduct research and add to the body of available nursing research knowledge. While not all PhD prepared nurses choose to work as researchers, all are exposed to great amounts of research and have to demonstrate their ability to conduct high quality research on their own. Nurses who obtain their PhD in nursing, salaries range from $80,000 to $200,000 a year, depending on the position of the organization for which they're in.
In conclusion, there are many opportunities to further your education beyond graduating from your BSCN. Just like any other program, sacrifice and dedication are necessary, but as discussed in this video, the outcome will be an enlightening experience towards your future being the best nurses we can possibly be.